My name is Marc Fishman, and I'm an addiction psychiatrist. As a member of the Clinical Advisory Board, I look forward to advising the program on matters of clinical treatment program and the development of new, innovative, exciting treatment developments as the program develops. Addiction is a very devastating illness, and it's puzzling to many people who haven't experienced it firsthand, either personally as a patient or as a professional taking care of addiction patients. One of the things that puzzles people so much about addiction is the difficulty in understanding why would people make the choices they do about continuing to use substances despite the very clear and devastating consequences in which people have loss of health and loss of livelihood and loss of family and even to the point of death. Why would people make those choices? And if it was only a matter of logical, rational, cool, calm decision making, well then clearly they wouldn't. But that's just the point. It isn't just a matter of cool, rational choice, but instead people are caught up in a process of compulsive, driven use in which they push on headlong into disaster in a way that's out of control and difficult really for the rest of us to understand. Despite knowledge, knowledge does not prevent it. It's really so much more than that. And addiction has a biology of brain reward. It has spiritual elements. It has psychological elements. It has family elements. It's really quite a complex and difficult illness. But the good news is that addiction is treatable. We have successful treatment, and it's able to help people restore their lives and restore their function and get better. How do we address addiction in treatment? What are the elements that we use for addiction treatment? We use psychological treatments, therapy, counseling, both group and individual. We use immersion and induction into the 12-step fellowship, NA and AA. We use family treatment. It's so important to include the family. Family where patients have cut themselves off and been isolated from the supports of their intimate relationships, their families. They've been rejected by family or have pushed family away. So bringing family back, reintegrating patients into those important connections, using and drawing on family supports, both to set limits in a loving but firm way, but also to offer support and to encourage people so that people can be reunited into the full nature of their family supports, which are so important. Sometimes family doesn't understand what's going on with a patient, what is happening, and so educating families about the process of addiction is a critical part of treatment. We also have increasingly developing relapse prevention medications that we use to treat addiction. Our best medicines so far are for the treatment of opioid addiction, but we're also learning more about the modulation of reward and reinforcement to reduce cravings in alcohol addiction and other substances, so that's a very exciting development. One of the important things to remember about addiction treatment is that when we begin with an intensive period of evaluation, immersion, role induction, and embarking on the journey of recovery in a residential setting, that really is only the beginning. After that, it's so important that patients continue that journey after their discharge from residential treatment with continuing care and ongoing outpatient treatment in which they continue to participate in counseling and therapy. They may see a psychiatrist, and they're certainly involved in ongoing 12-step meetings, NA and or AA. All of those things because the healing process is really a marathon, not a sprint. And so residential treatment, while so important, is just the beginning, and people need to keep on going in a longitudinal way. Another modality that we use frequently is the evaluation and treatment of co-occurring psychiatric disorders. So many patients who suffer from addiction also have other mental health issues. Mood disorders are very, very common, but sometimes we see difficulties in a whole host of other ways. Infrequently, there may be psychotic disorders. There may be histories of maltreatment and trauma. We see gambling very frequently. We see difficulties with intimate relationships and sexuality. All of these things can sustain and be intertwined with the difficulties and functional impairment that addiction brings. So psychiatric assessment and treatment of those co-occurring disorders is another very important component of addiction treatment.